السلام عليكم دكتور عبد القادر. Do you hear us well?
وعليكم السلام, Dr. Farha. Can you hear me well?
Yes, we hear you now. That is very good.
That's
Yeah,
nice.
alhamdulillah. So we will now start our webinar. Thank you everyone for joining us. And thank you for your patience as always, those technical issues. So at the
No,
start,
it's okay.
yes, inshallah. So hello everyone and welcome to our second episode of the Humanitarian Heroes, Voices from the Frontline. This is a monthly series where we host every time one of the world's heroes, humanitarian heroes, in fact, and the ones who are looked at the impossible moment and chose to act. Through this webinar podcast, we are giving them the microphone to hear their stories, their motives, and their actions, and to discover the stories behind the scenes, learn how we can support them, and hold on to the hope for a better world. This season is led by Peace Lab, a faculty-led lab by Professor Kaveh Khoshnood at Yale School of Public Health in collaboration with Aurora, Humanitarian Initiative, Health Tech Without Borders, On the Ground AI, and PAs for Global Health. My name is Fayhada Fa'allah. I'm a postdoc associate at Yale School of Public Health, one of the co-founders of the Peace Lab. And today I have the privilege for hosting this conversation with our guest. And before I introduce him, I need to tell you why this episode matters to me personally. And because the context is everything when we talk about war, about loss, and about human cause of conflict that never makes the headlines. I lived in Sudan during the first year of war. The war is still continuing in Sudan since 2023. I lived through the checkpoints, the silence before the shelling, and we learned to read the sky for drones, and we witnessed the collapse of the health system firsthand. I personally did, being the pregnant woman who left with no choice but to give birth amidst the chaos. That experience does not leave you and actually becomes a lens. And today I bring this lens to this conversation. And I also bring another one. In 2018, for this, I'll tell you this story. It's very personal. That is, in 2018, just a few months after a wedding of my husband's cousins, we attended the wedding in Kenya. It was a celebration of joy and hope. And we listened to the whole dreams that those couples have. We lost that cousin of my husband in a bombing in Mogadishu. He was young, full of dreams, and he was newly married. And he was just gone in an instant. I still remember that call, and I still remember the silence that followed. From my experience, and even then, when I read about someone in Mogadishu who saw people carrying their wounded in wheelbarrows, those victims of bombing, or anyone who is just a victim of the collapse of the health system, whether they are a pregnant woman or children. And they decided to spend their life saving those people and serve them. And we see now Dr. Abdulkadir as one of those people who started that free ambulance. I realized one thing. I realized something very important, that sometimes when the world really ignores us and when the system fails us, there are still people willing to sacrifice everything for another people or for their community. So our guest today is one of those people, Dr. Abdulkadir Abdirahman Adan. I hope I pronounced her name correctly. Adan, right? Okay. It's a Somali dentist who returned to Mogadishu in 2006 after he was being trained or took his training in Pakistan. He's a founder of Amni Ambulance, which has grown from a single second-hand minibus into a Somalia's largest free ambulance service, operating 24/7 through a hotline 999, and is staffed largely by volunteers and funded mostly by the Somali people themselves, $1 at a time. Dr. Adan has been recognized by Aurora Humanitarian Initiatives as an Aurora luminary, and he has transported over 250 injured people from one of the single bombings. He has buried some of his staff, drivers, and a paramedic, and he has been targeted himself while he trying to reach those wounded. But listen to him, yet through all of that, he says, the most valuable thing to me is human life, and that is my driving force. Dr. Abdulkadir, it's an absolute honor to have you with us today. And thank you for trusting us with your story.
Thank you. Thank you, Faya.
Thank you.
Thank you, Faya, and the entire team behind the Peace Lab speaker series. So Yale School of Public Health, Physician Assistants, and Global Health. And everyone joining us, I'm honored to be with you. I'm usually not a virtual stage, but I'm here because that you are building a bridge between the scholarship and frontline matters.
Thank you, Dr. Abdulkadir. Thank you for being here with us again. I think your voice was a bit breaking, but we can still hear you. I hope your internet will bear with us. And thank you everyone for attending us this webinar. So as I have this lens through my experience in Sudan and that personal story from our cousins in Mogadishu, you saw a city where people were forced to carry their bleeding or loved ones into a wooden wheelbarrow. And when you look at that scene, what was the exact moment where that you realized you shouldn't look back and you should act? Please tell the story from the beginning, Dr. Abdulkadir, from when you came to Somalia and you started your clinic and then you witnessed all those people, all of the population around you who are not being transported properly, losing their life on the way. What was describe to us that exact moment when you decided to take an action rather than to be one of the people who witnessing what's going on? You are muted, Dr. Abdulkadir. We can't hear you. You're muted. Yes.
Right now?
Yes, now we can hear you.
Yes, I can hear you. Thank you, Dr. Faiha. From the day I back to Somalia, I have been trained as a dentist from Pakistan, fresh graduate. I opened my clinic, but again mounted. I opened my own clinic inside the biggest market, which is called and there was a big conflict. The impatient government and opposition there was a fight against each other. Then I have seen a lot of people was dying in front of my clinic, using wheelbarrow to take from the scene to the hospital, and some of them was used to die on the way to the hospital because of the catastrophic bleeding.
Yes, Dr. Abdulkadir, we keep having your voice broken, but I think we capture all of those moments when you open your clinic. Would you describe that moment exactly? I'm not sure we heard you. Would you like to repeat again that moment? Why have you decided to act? What motives?
Yeah. I have seen a lot of people dying in front of my clinic using wheelbarrow as an ambulance. There was no
Yes, yes. I think it's one of the it's really very sad to see all those people in front of your clinic who are losing their lives or being of course not being well transported. Yes.
Yeah. They was using wheelbarrow as an ambulance.
Mm-hmm.
Even the pregnant mom,
Mm-hmm.
the dead body, the injured one, they was using wheelbarrow. Then I asked myself, what kind of dentist you are doing?
Yes.
Just caring about one teeth. Why don't you care about the as human life? Because also human life matter. Then I decided to start an artery ambulance service. I spent all my savings to buy one minibus second hand, and I paint it
Mm-hmm.
out as an ambulance, aiming ambulance. Then I started that way. So the fleet become bigger and bigger as it today. Imagine such infrastructure of ambulance. Then I grow up with
Yes, it's a very impressive that you decided to move from a person who is witnessing all this devastation in front of him to a person who want to make an action using their savings to buy that minibus to turn it into an ambulance to save people's life. So at that moment, when you made that decision and you start to act upon it, how did your family and community react it? Did they share the same vision that you are? Did they see you acting out of putting your life of unnecessarily danger or tracking out of your career? How did they perceive that?
yes, actually, so many people was thinking that I am mad, that I am, yeah, you can understand that I'm Majnun, like. But I told them that I am. So many people, my personal family was saying, Abdul Qadir, you will be killed. You will be killed. And I told them, even if I don't try, I will die one way or another. All of them, my brothers, my mom, and my father was saying, it is not the time. If you are mad, you have to go to your clinic, you have to continue your work. Then I told them that I'm not give up. I will not give up. I will try my best to save my people, to do whatever I can do. Then I decided that this way to start this free ambulance service, which become very easier for me. I campaign it. I go every house and every student. At the same time, I was university lecturer asking my students to pay $1 to save one person. In this way, I continue.
I hear you, I hear from behind the words that is wasn't easy to start that ambulance service that you have spoken. You know, you needed to and have the people around you to share your vision. So it makes sense, I think, at the situation like uncertainty in Somalia that your family fear your life because you are the one who's supporting your family and I think anyone in that situation would have their family have the same feeling. And from here, I would like to ask you, you chose the name of Amni, which translated into trust. And I think you needed to build that trust, right? For the people to share their vision with you, whether they are your family or your students that you spoke to provide with all that support. So tell us why you
Yeah.
chose that name and why trust really matter in the context. Tell us a bit about the context around in Somalia, and tell us why you chose this name and how this has impacted your work.
Yes, yeah, good question. Actually, the Amin means trust in our own language. It's trust. Yeah, actually, people in conflict zone, they fear the ambulance more than as they fear from the bomb if they don't trust you. So you have to build a trust. We started from the name up to the end. We started to that a trust usually is not built inside the board meeting or boardrooms. It is built. Trust is built in the ground, dealing the people with the equal. Right? You don't care about what kind of religion, what kind of color, what kind of race. When someone is bleeding, all this not will not be matter. So in that way, we build the trust of the army ambulance. And the ambulance is not just a vehicle, it's a system. And it is a statement which says, whoever you are and whatever side you come from, we came for you to save you. And they know that we are not taking a side, we are taking the life to save it. In this way, or long journey, we build the trust, and people they trust us a lot more than anyone else.
Yes, I agree. I agree with the concept of trust. It's very impressive that from a name you named it trust, and you actually were able to be that trust. I believe it wasn't an easy mission, but it was a very good start and the right start, I believe, in this context. It strikes me when you say people here fear the ambulance more than they fear the bombing. Is it because the ambulance could be targeted itself, or whether it is the ambulance service can be discriminatory service? Why do you think people have feared the service that is provided for them? Not because of you, but because it's a service of ambulance that could save their lives.
Yes.
Dr. Abdulkadir, I think we lost your voice.
Can you hear me?
Yes, now we can hear you.
Hello.
Yes, Dr. Abdulkadir, would you like to turn off your camera so we can hear you better?
Yes.
Yeah,
Hello.
we can hear you now.
Yeah. Actually, people they fear the ambulance. That means you must be either of two. Either you are enemy or friend. That's what they used to. They don't know they don't they did not use it to be a mediation. And they don't believe that someone is coming to save you, who is not your friend, who's not your family, who's not someone who is taking the money from you. They don't believe it. So in this way, they used to say, you must be your enemy. If I said I'm not your enemy, they said then you must be your friend. Then I said either of them. I'm here to save you without taking money from you, and without as well. I'm not your family member, but I want to save you because they didn't use it before. It was not existed the free ambulance service in Somalia. It was the first time, and it's quite difficult to believe you.
Yes, now I can see what you mean by how trust was very essential for you to be able to establish the service and actually to serve the mission. And that is very impressive that you were able to mediate between to be the health provider, to act your role, and to make the community believe there is someone who can be neutral, and actually the medical service or the health service is a service that is neutral, does not differentiate between an enemy, but rather have a mission. And that's really impressive. And building on that, as now I would say at that moment, you started to have that trust and you start to operate safely, I would say. However, that trust does not stop, the fires, does not seize the fire, does not hold the fire away from you, does not, as a bomb, does not differentiate between who is there around. And how did you deal with that when it comes to your drivers, to your team who voluntarily and put their life in danger, and you lost some of those lives in the line of duty? How you mentally prepared yourself and prepared your volunteers? Even now you have the trust of the people, but you still put your life on the line for the others.
Yes, actually, let me tell you something about the kind of leadership which means where I'm working. Kind of leadership is needed. It is not a promotion. It is a decision made in 2 a.m. Like when bombs fall or crossfire or car accidents or what you call explosions take place. It is this decision to make in 2 a.m. I mean, late time, it can happen. So you have to take a decision. In this way, we have to take the decision either we drive towards where the accidents happen or explosions take place or bombs fall or away from it. When by the time I was starting, I'm in ambulance, I had no building, no government contract, no guarantee of safety. You see, when everyone is running from the scene, I was running towards it just to save others. I just risk myself. Uh, Can you hear me?
I hear
I
you.
just risk myself to save the others because by the time I reach there, I sometimes saving more than 20%, 50% or more than. So that makes sense. So I had no, just what I had was a simple belief. No one should die on the way of the kid, simply because of they are poor or because the road are too dangerous. That was my belief, just to save someone, to rescue yourself and save others. Yes, you are right. Bomb or explosions, they will not classify or they don't know who's there. And usually there may be second explosion which is pre-planned for the first responders. It happens to a couple of times. We lost drivers, paramedics, and sometimes ambulance was destroyed. It happens before. But at least we tawakkal ala Allah, we we just say, my Allah, I'm going to save the others, so Allah will save me. We believe that.
Yes,
In
that is
conflict, and moreover, in conflict zone, as I said before, it is not just a system. It is not just a faker. It's a system of neutrality. You have to deal with them either whether they are the government soldiers or oppositions. You have to deal with equality, equal rights when it comes to the safety or when someone is bleeding, they have same rights. Now, even his name will be changed as they say he's that body. We say the name is changed. He's not now. He's not a government. He's not opposition. He say dead body, injured person. So as it is, we deal with them equally. So it is sometimes happens, as you said, pre-planned explosions, which usually for planned for the first responders.
Yes, and that is a very heavy and unbelievable emotional and mental load that you've been through, and your team as well, and that is really appreciated. And we hope to continue operating with that. So, and that is the human cost of it, I believe, right? To have a mission and that you would devote your life toward that mission, knowing that you may make it or may not. And that is the heroic situation and the status. So beyond this human cost, I would like to touch a bit on that real materialistic or material cost, the ambulance as operating as a free service, right? And you were relying on the local donation and diaspora support. And just tell us from the beginning, what was the day-to-day reality to keep this work running, given the strained resources, especially when you first started the ambulance service in this conflict-heavy situation?
As I said before, actually, by having seen my people was dying in front of me, that gives me a spirit to start the free ambulance service to save them. And moreover, as you said, right now, I have been rely on donation of local people, which was very challenging. You can just imagine $1 a month, and just knocking every door, and every student is talking to them or to her by saying, please pay $1 to save your friend, your family member, your country fellow. It was very challenging, when it comes to the cost, or it is very challenging. When before I before I think about my bill of my house, I usually think about the army ambulance, their fuel, tire, some gift of the frontiers. I was thinking about it rather than my family members. Sometimes my wife was asking me, "You are paying money to some people while we needed it." But I told them, community are more than us, because of they need us more than what we need from them. And it is the hardest time, or it is the darkest time. People, they need you. You have to help them by the time they need you. If he or she is not injured, or if he or she don't need the ambulance, what will you help them? Nothing. So by the time of darkness, you have to help them. So she also bring her, what you call ears or necklace, the gold that she was wearing, or share, what you call, hair gold, the
The earring.
necklace, earrings. They she bring to me to buy it, to buy it, and use as a fuel or tire. Actually, I do believe it is quite challenging. By funding. Funding is it is the most challenge. Two things are challenging. One is the security, another one is funding. For funding, I was after my students, then I used to go to the businessman to ask them to pay at least zakat, what do you call it, zakat, by the time 1 year after, when they finish the 1 year. I don't know what to say in English, zakat.
Yes,
Then
yes. For the
they give
audience,
it.
the zakah, it's a religiously in the Islam, is amount of money you pay for all the money you have. And if anyone have you can Google that and know what is zakah is. It is a mandatory amount of payment people bring and pay every year. So you've been asking the businessman to pay your zakah and to give that zakah toward the service of the ambulance, right?
Yeah. We keep continuing that way. But as long as it's going on 20 years, many people cannot continue to be with you for this long time, long journey. They say it has to be finished. You have to stop it. It's enough. It's enough. But I told them, as long as human is there, ambulance is needed, because hospitals never come to you. You have to go to the hospital, and the only way to go to the hospital is you have to take an ambulance. You have to go to a taxi, or whatever. But if the vulnerable people, whose poor family, poor mother, poor father, who cannot afford what they will use, they need free ambulance service. And so I told them that I will not give up again and again, and I will continue as long as I am alive. As there is a human in Mogadishu, as there is a human in Somalia, I will continue. And I will continue, inshallah.
Inshallah. It's very touching to hear the story, to hear that how your wife and your immediate family has sacrificed their own jewelries to support the service, to support you. So it's very impressive to see from starting by yourself and trying to own those support from the people around you, your students, and looking at the bigger picture from that social fabric that need to maintain for us to survive in a community that is usually forgotten or neglected globally and failed by the system. I just want to remind before I continue our participants who are live with us now that you can put your questions in the Q and Ask part section so we can answer them by the end of this conversation. So Dr. Abdulkadir, I feel the struggle that you are talking about right now at the beginning. And I believe in such a situation, the resources are usually scarce, no matter how much they are, because the need is very big. True. And you are committed to save those lives. And that does not stop you. However, you could have chosen to provide the service to the safest place through the accessible areas, but you went beyond that. We heard from some of the news, and I read some of the reports while I'm preparing this about you have also participated in saving lives where there is gun battle in one of the prisons, riots, or jail siege, if I remember correctly, and you treated the wounded guard, the civilian, and the prisoners themselves alike, right? And that is the essence to maintain that medical neutrality, although it's not easy as well at the same time. So would you like to share some of the specific stories of having the impact with the people behind those parts? Yes, please.
In Brussels, yes. Here in Mogadishu, there's a big prison which there's almost 3,000 prisoners are in, and they have a lack of facility of health. There is heavy and or you can say inhumanity of they don't have the right of health. There's no hospital in it, no health post in it, and they cannot go to out of the prison.
Yes.
Then I started to give them free medication. In this 3,000, some of them they have hypertension, they have diabetic, some of them they have skin disease, they have mental disease, they have nutritional imbalance. It is actually uh, these people they need a lot, but the only thing that I was able to do is to help them in for medication, to give them medication, to bring them a doctors, to visit them, to check them if they need any checkup, if they need a checkup, and to give them medications they need. It like skin disease are a lot because of the depth of that area. It is very dirty. They don't have mattress good, or they don't have blankets. They need everything. You can say that's human rights. No matter the person can go to the jail whatsoever, but he has to have other rights like nutritional balance and what you call medications as well. So many of them they thank to me, and still we continue to give them any medication which they need. It is essential drugs, and it's essential for health for them.
Yes, that is really impressive. Seeing that values that we usually learn to be, practiced on the street, on your work, and bring them closer to the people. So we see the translation of those values of being neutral, for being supportive, for being dedicated to your mission. And you also, I believe you brought those values to your classroom, right? You are a chairman at the board of Jazeera University that you established yourself. So tell us a bit about how do you teach the next generation of Somali leaders, the young ones that you are encountered, to prioritize philanthropy, nationwide building amidst this chaos, and maintain the social fabric as a way to improve and build the country?
Thank you so much again. Jazeera University is actually it has been founded in 2010. It's almost 50 years today or 60 years today, and we teach them a lot of students to bring them some people they can pay, they can go to the school to pay their fees or you call tuition fee, and some of them they are very poor that they cannot afford, but they are able to study, but they don't have the money. So we go to the IDB camps, IDB camp students. We bring them from there to the university and to study. At least every year we give them 100 students for full scholarship, just to to study something instead of going to the Tahrib or you call or going here and there or otherwise they will go to be soldier. They will be soldier either side, either government or the opposition. So to protect them, we give them scholarships to study any kind of subject they are needed. In this way, we almost in these 15 years, many students graduated from it, and we are really very glad and very happy to see those students to save their life, not only their life, even their family. As they graduate, they will get job, they will help their family, even their themselves, they are helping another students, like they are helping their young brothers to bring the
Yes.
university or school. So I'm really glad to do that. It was really a milestone.
Yeah. That's really powerful, honestly, to see you not just only saving the life on the line through the service, but actually actively, building the new generation. I didn't read while I'm preparing for this about the scholarship from the university, and something that is, I'm so proud to hear that you are, building that blueprint for the generation to come through your work on the ground and through the education that saves even more life that is indirectly and build the fabric of a country. And that is very impressive. And looking into those decades, almost 2 decades, right? 15 years of the university and the same for the ambulance. And you achieved so much milestones. I don't know how many students you have graduated from university right now, but 100 a year is a really big number. And also on the ground, you saved thousands of lives, hundreds, thousands of individuals. So just looking back and reflecting back onto this, do you have one specific patient that you rescued, either from the death on the road or through your education that you saved them from the IDPs or from the misery of life, who have perfectly encapsulated the term of every life matters?
Thank you so much. One K, 100,000. It's just a number, but there are so many young. Still, I remember a young girl. She gets, injured across the crossfire.
Mhm.
We save her. We bring her to the hospital. She survived it, and fortunately, she became one of our students. And today she is one of our paramedics. She is saying, "You saved me one day, and I want to save the others." I still remember. Another history was we took a pregnant mom from her house, and she gave birth inside the ambulance. Then later on, she named her son Amin. That still, I remember it. So there are so many histories same like that, but we record that one, and they are still with us. That mother, she gave birth inside the ambulance. We save her. Then she named it. She named her son Amin. I'm really glad to know that. And the other one, the girl who get injured inside the crossfire, when she saved her, when she saved, when she when we take from the scene to the hospital, she survived it. We keep continuing because we know she was a poor. Even she could not get a food. We give her some nutrition. We give her some food to bring her daily. When she become okay, she said, "I want to save the others."
Wow. I think there is nothing could be so much rewarding and satisfactory than seeing people from the lady who saved and then became your student and then became your paramedics. I think there's nothing could be more rewarding and worth, you feel like the life that you gave, all the risk that you went through and your team is actually worth it. And even me now here, just looking at the smile on your face, I can feel how this could be very emotional and give you a constant feeling of satisfaction and constant feeling of you want to give more. And that's really, really
Thank you so much.
something very it worth it, I would say, in a simple term. Seeing your vision. I wanted to ask about for your vision. Although I see your vision actually being materialized throughout those decades, but it's still, I believe the vast there is a vast need, a very major need in the Somali. Now you operate in Mogadishu and around Mogadishu. If you have unlimited resources now, right now, if you have that unlimited support tomorrow, what was the first thing I would like to build or fix? What is your vision? The big
Uh,
vision.
really, if I get that dream, unlimited resource, I would build a fancy hospital. I would build a network of ambulance. I will take every village to Somalia to to bring a one ambulance at least. Every village or everywhere in Somalia there must be an ambulance. I'm very that's my dream. That's my dream to see whole Somalia having an ambulance every village, every sector, because of we have over here in Somalia, child and mother mortality are highest rate in all over the world in Somalia, and it's because of lack of transportation. If there is a transportation, that mother will be taken from her house to the hospital easily, and she will survive. So I want to stop, preventable death. I do believe it's preventable death. You know, they are using wheelbarrow almost 10 kilometers away from the hospital. 10 kilometers, image. It is quite difficult to save that person. If she is pregnant mom, if he or she is injured person, it's quite difficult. But whatsoever, if I get that dream, if I get unlimited resource, I will build network of ambulance.
That is impressive, and I think every Somali person, whatever they are, whatever what's going on, their affiliation, their tribe, anything, they deserve to be saved. Every life deserve to be saved, and it is very powerful. Just looking at the beginning of a story where you dare to dream beyond the possible, it became a possible. And I wish this dream become a reality one day, and we support from what we can. And I think this could be resonate with many of our audience here today. So I'm turning back the my mic toward them to hear some of the audience questions. Um, I don't see questions in the Q&A, but I can read for you some of the questions that we received when the audience have registered to us. So the first question here is, you built Amni Ambulance on trust with ordinary Somali, giving $1 a month to keep it running. Aurora connects you with more than 100 humanitarians who have built their work on the same solidarity in some of the world's hardest places. What does it mean to you to be part of this wider community of trust? We can take one question at a time. So how does it feel? What that it means now you are connected with a wider community at this stage?
Being a part of Aurora Humanitarian, it is like finding a family you did not know to hide. You did not know you had it. You know, when you are in a conflict zone, it's easy to feel alone. But knowing that 100 humanitarian across the world are with us or with me in spirit, praying for us, advocating for us, defending us, it lifts me up. It is like a family, really. This critical moment in Somalia's history, the community reminds me. The community reminds me we are not alone. We are fighting together. I do believe having this kind of network, it is very, very, very important. We have same feelings. They are doing what I'm doing in Somalia, either in Sudan or in somewhere else or wherever in the world. And today we are in a network. They know me and I know them. I respect them, they will respect me. I advocate them, they will advocate to me. I donate them, they will donate to me. That is really a family really. And I'm thanks to Aurora initiative.
We are also thankful for the Aurora initiative to bring you to the light that we know about your work. That's much appreciated, moving from being just a person who's working locally to be well recognized, to expand your mission and to get more support. We have another question here. I read, Amni Ambulance is a beautiful example of community-led, grassrooted initiative funded on $1 at a time by the Somali people. From your experience, what is the biggest mistake international aid organizations make when they try to help in the conflict zone? And how can they better support local self-sustained models like yours?
That is really a very good question. I can say an international donors or international NGOs, when they want to help or when they want to help the other country, which they don't know, some people they dislike humanitarian. Is dislike of humanitarian route is a legitimate, concrete fear. There is a fear. There is a financial mismanagement, cultural insensitivity. There is a responsibility. When they want to do internationally, they have to attach with the local people. And as Aurora doing, Aurora they directly deal with the those who are in ground, the one who is doing the things. But when in international donors or international NGO, they have to deal with the local people, as they don't know the language, as they don't know the culture, as they don't know the religion, because there are a fear of, and sometimes it's a reality. So we have to face them. They have to learn from them. They have to deal with them. They have to manage it. Sometimes we must remember that humanitarianism is not about us. It's about the people we are serving to. Example, as an army ambulance, we try every day to earn a trust of Somali people. We are not perfect. I do believe we are not perfect. We are committed to serving with integrity, with humanity, and respect to the others. So, because of as long as you are helping them, you have to respect them. You have to deal with them as integrated person. If I'm hungry today, if I don't have something to eat, it is late to you. You have to respect me. Give me something, but with respect. So international NGOs, the mistake they are doing is that they are not dealing with the local people. Cultural difference, language difference, religion difference, maybe colors difference. So I do believe we have to, we have to face the international NGOs or international donors. They have to face the people they are dealing with. They have to learn something from them, and they have to respect their elders. They have to respect their cultures. They have to respect their religion as well. So I think that is the mistake they are doing. And the other side, the other good, the other way they can help is to deal directly with the people who is doing the things, those who are in ground. That's my what I, that's what I, that's my thing.
I think this is a very excellent advice to the humanitarian actors, especially now we are facing a global instability, especially in our regions, to align with the local culture, with the local beliefs, to align the work and to connect with the community who are beneficiaries to best use of the support they have. This is a very excellent best practice. Thank you for sharing that. We have a couple two questions. One of them I will ask now, and the other one I will integrate with the last question that we are going in the closing. So, Dr. Adan, you've been trained in Pakistan as a dentist, someone who can work very good in the clinic, schedule appointments, and with a controlled care. Yet, when you return to Mogadishu, you and built in this chaotic, high stress, life-saving emergency fleet. How did you operate? How did your training as a dentist prepare you for the raw, unpredictable reality of running a war zone ambulance service? Do you ever find yourself missing the quiet of the dental clinic? Are you still practicing?
Yes, actually, you are right. Yes, you are right. You are really right. But as I said before, again, I will say, by the time my family members, let's say, just forget about the others. My family members are bleeding inside the road, whether it's a car accident or explosions. And I am just sitting at a dental chair by thinking about the one tip. That is, I can say, it's inhumanity. I have to think about the whole body of the person that I can save him instead of thinking about the tooth. Without teeth, you can remain alive. But if you are having a catastrophic bleeding or artery is cutting, you cannot remain alive, isn't it? So, by the time I was, yes, you are right, I have been trained as a dentist. Yes, you are right, as a professional, you are right. I have a clinic, you are right. But is it which one is better to save a life or to save a tooth? One tooth, just one tooth, just one tooth. Imagine by the time I was coming in 2006, there was a conflict, either civil war, you can say government opposition, invasion of Ethiopian army in Somalia and in Mogadishu. There was a heavy, crossfire. There is heavy explosions. There was no an ambulance, and people was dying in front of my clinic.
Yes.
I was the health professional who's living around. And I know why this person is dying. It's because of bleeding. Can I stop it? No, but at least I can take him to the hospital. I ran to the hospital. I can take from the scene to the hospital. That was the easiest I was able to do. So something I can save my community. Why I don't do it?
Yes, sure.
I can do it, and still, I did not reach my point really. What I want to reach is, Somalia to have helicopter ambulance taken from the region to the city. taken from the other region away, which is away from us. If I have a helicopter ambulance, I will take from that to the capital city where the hospitals are overcrowded. So that was what was, by the time I have seen a pregnant mom using wheelbarrow as ambulance, an injured person who is using a wheelbarrow as an ambulance, a dead body or body parts carrying a wheelbarrow as an ambulance, I decided to stop or to close my clinic and to use the chaotic really and open my heart to save the others.
No, that's excellent, and I hear you. We are all the health professional who had an oath to save lives, and you chose to save lives beyond your dental clinic, and that is a big dream. And what you have built on a shoestring budget is nothing short of a miracle. But the miracle, like Amni Ambulance, shouldn't have a struggle just to keep the fuel or, to keep the brave volunteers and medics safe. And there's a lot of questions when we hear your story and read about it. So for everyone of our audience, if you would like to learn more about the Amni Ambulance, please go to the website, which is amniambulance.org, and learn more about what is going on and what have been happening since the establishment of the ambulance. And for the one who is listening for us today or live or who are recorded later on, who are part of the global community or the Somali diaspora, Dr. Adan, tell us a bit, how can we support you? We have a question here also on, and I would like to bring, what can the academic institution do to support your important work? What can the people on the field, the community, to support your mission?
Actually, here is many ways that you can support us. I would like to ask you three things today. Three things to left it. Don't just study Christ. I want to say that whoever joined to us, don't just study the Christ. Prepare to enter it with humanity. Don't just write about the equity, fund it, protect it, and demand it. If you don't protect it, equity, if you don't protect it, no one will respect it. If you don't fund it, no one will do it. If you don't demand it, no one will give it to you. And third thing is justice. Don't write about the equity, only protect it and demand it. So many ways that you can help us. Either what you can say, either in cash or in kind. Can I say like that? Either in kind or in cash. You can advocate to us. You can pray Allah for us. What you can say, let me do it. In this way, by the time you are away from us, it doesn't mean that you cannot do many things. You can do a lot. Example, the data that you are analyzing and policies that you are writing or advocating or funding that you are advocating. And by the time you are pressuring the leaders to sign the ceasefire, it all really fuels the ambulance. If they stop the fire, we get rest. So you have to pressure them. So I do believe that you can help us in that way. You can chat with us. You can pray Allah for us. You can donate $1 to save the others. You can give us, in kind or in cash. Many ways.
Thank you for sharing this. Of course, so many people would like to support the ongoing work you are doing and to have save the Somali population, of course, and expand beyond, expand through your mission, of course. And thank you for sharing that. And I think we'll close with the word of wisdom that you shared. I like it really. If you have a dream, protect it, invest in it, and demand it for us to happen. And with that, we close this conversation that is end here, but of course, we continue through different corridors. Feel free to contact Dr. Abdulkadir Adan through his website, through his team, and even through us. Feel free to do so. And we hope this conversation has given you a new lens through which you look at the world, one that moves us just beyond being passive observant of conflict to active partners in survivals. We can see saving someone and who can actually save their life through a direct support to services like ambulance or through education, through mentoring. There's so many ways. I hope this is to remind us that all the communities in crisis are holding each other up every single day, and that our support is a bridge to keep them going. Thank you, Dr. Abdulkadir Adan. Your words, your life, your stories, your courage are profound reminder that even in the darkest, most impossible moments, in the midst of the chaos, there is always a choice, and we can take that choice. And you chose to not to look away, and we hope everyone do so, whether they are on the ground or far away. So there's something we can do: advocate, provide your in-kind, your cash, whatever you think you can do that could be someone their life. By keeping those ambulance moving through Amni, we are not only saving the lives, but we are keeping also collective belief in humanity and alive, a trust that have been built. I'm really happy for that neutrality that is translated into an action. Our audience, thank you so much for joining us for this episode. For the one who are going to hear this recording, please also feel free, no matter how old this video became, there is always a way to support the ambulance. These episodes have been brought to you by the Peace Lab, a faculty-led lab at the School of Public Health by Professor Kaveh Khosnout. He is here with us today, with partnership with Aurora, Humanitarian Initiatives, Health Tech Without Borders, On the Ground AI, PAs for Global Health. Until next month, we are looking forward to see you. Look out for impossible moments around you. Choose to act. And thank you for listening. Thank you, everybody.
Thank you.
Assalamu alaikum.